I'm curious. I am curious. Curious.
By nature.
Welcome to Curious by Nature. I'm Jessica Johnson from Newswise. Heart attacks are the leading cause of death worldwide, but what many people don't know is that younger adults, especially women, are at risk. Too often their symptoms are dismissed or the real cause is missed entirely. Dr. Claire Raphael, interventional cardiologist at Mayo Clinic, led a 15-year study uncovering these hidden causes, artery tears, coronary spasms, and other conditions that standard tests don't always detect. These findings are critical because they explain why so many women are misdiagnosed and why lives are being lost unnecessarily. Her research is forcing medicine to rethink long-held assumptions about who gets heart attacks and why. And the takeaway is simple: awareness saves lives. Dr. Raphael, welcome to the podcast. Please introduce yourself.
My name's Claire Raphael. I'm an interventional cardiology doctor at Mayo Clinic in Rochester, Minnesota. So I'm curious about my patients, how their diseases affect them, how I can improve care and provide better care for them, what I can do differently from a research point of view.
Based on your recent paper, you were looking at heart attacks in younger women and how historically the cause of these heart attacks has been misdiagnosed. Can you tell me more about this paper?
So we performed a 15-year study looking at rarer causes of heart attack. So the really common, the traditional heart attack is cholesterol buildup in the arteries, causing narrowing and causing chest pain. But what we found in our study is there's actually a lot of rarer causes of heart attack that often don't get recognized at the time that they come in. And that's particularly common in women and in younger persons. So causes of heart attacks can be things like a split in the artery, which is called a spontaneous coronary artery dissection, or things like spasm, where the heart artery just cramps down by itself.
Could you tell me more about why those things happen, like the split in the artery, or I think you have referred to it as the SCAD?
We call it SCAD, which stands for spontaneous coronary artery dissection. And why it happens, honestly, I wish I knew. It's a strange disease. So we know it's much more common in women. It's usually younger women. And around half the time, there's been some vigorous exercise beforehand. So maybe that's caused the split in the artery. But a lot of the time, there's just no good reason why it's happened.
Do most people know at the time when there is the heart attack that that was what it was, or is it misdiagnosed?
Usually people feel pretty bad with SCAD, so you aren't getting a good blood supply to your heart. So a lot of people will come into hospital with chest pain, and providing people do the right tests, so an EKG and blood test, then we'll find out there's a heart attack. But often the assumption is that that might just be a traditional heart attack, so cholesterol buildup, rather than realizing it's something rare.
With your research, your recent research, you saw that a lot of times it is not just that buildup, but it is the SCAD.
Yeah. So, one good thing is, we looked at a 15-year period from 2003 to 2018. We've got a lot better at picking up SCAD. So in 2003, a lot of these patients got misdiagnosed. But by the time we got to 2012, we actually got very good at picking it up and realizing what was happening in the artery.
I find it kind of scary and fascinating that such common health issues like heart attacks haven't necessarily been investigated, particularly how they're unique in women.
So I think it's a really big problem. And the scary thing is, the youngest patient in our study was 23. So if a young person at 23 goes to the hospital and says, I've got chest pain, you'd be surprised that they were having a heart attack. So fortunately, these things are really rare and we are getting better at picking them up. But traditionally, we'd always thought heart attacks were in older people, smokers, people with a lot of other disease states. And the fact that they can happen in young, fit, healthy people is quite sobering.
Is your study maybe more recently something that is unique, looking at women's health particularly, or has that been looked at in the past?
So one really good thing about our study is because it was based in a community, we looked at everyone that had had a heart attack in a defined geographic area, whereas most studies you pick up patients from the hospital or you see patients that have been recruited into a trial. And historically, most trials in cardiology are about 80% men and less than 20% women. So it gives less opportunity for us to look at these rarer causes and heart disease in women.
What's the percentage of women under 65 that have heart attacks?
So fortunately, pretty rare. So I think it was about 20 per 100,000 people in our paper. So still really rare. And fortunately for the ones that did get diagnosed, they actually tended to do really well. So although you'd had a heart attack, 5 years later, generally these people were doing really well.
Are there ways that women's heart health has wrongly taken on characteristics of men's heart health?
So I think we've got a lot better about this over the last 20 years. So about 20 years ago, the assumption was often women were less likely to have heart attacks. And that's definitely true. I mean, in our study, there was 8 times as many men having heart attacks as women, but it doesn't mean that women don't have heart attacks. So if it's a woman, especially a younger woman that doesn't have the traditional risk factors, we just need to look a little bit more closely and make sure we're not missing a more unusual cause of the heart attack.
Are there any critical things that younger women should know about their hearts and maybe what to be aware of?
I think the important thing is if they get chest pain or something just doesn't feel right, so sudden severe pain in the chest or feeling really short of breath, then it's important to get checked out. And just knowing that even if you're a young, healthy woman, you can still get a severe condition. That's important to know.
What about maybe how to distinguish the difference between cramps or some certain types of pain versus maybe something that is more serious?
So that's a lot more difficult. In general, we say if the pain is constant, it's not worse if you turn one way or worse when you're lying flat or sitting up, then it's probably more likely to be coming from the heart. But there's exceptions to every rule. And in general, I think a lot of people just know that something's not right. And that's the time where it's really important to encourage them to get seen by a medical professional.
Sometimes it seems like maybe there are cases where people really don't clearly know what's happening to them, and then it causes additional problems. Do you see that often?
And that's definitely something we see. And it's often younger people, I thought I just had the flu. I thought I just had a really bad virus. And then in retrospect, they've actually been sick for a few days. So it's difficult because, we all do that. We all think, oh, I'm fine, I'm healthy. Do I really need to go to the ER? But I think when in doubt, it's just much better to get checked out.
On social media, I've seen a post that I'm not sure and maybe needs to be kind of fact checked in a way about a woman saying, if you feel pain in your heart, and she wasn't a younger woman, but you have heart and chest pain and you feel like you should go to the hospital, start coughing and breathing very hard out of your lungs. And it has maybe hundreds of thousands of views.
Yeah. It definitely wouldn't hurt. I mean, sometimes you get, especially if you've got a chest infection or an pneumonia, if everything's all kind of gunged up in there and you do take a really heavy breath and clear your throat, you can breathe a bit better. And I think if that made no difference whatsoever, that would probably support that you do need to go get checked out. I don't think it's based on much, but I don't think it would hurt to do that. So sometimes when people have got a very fast heart rhythm, we get them to breathe really intensely. And sometimes we get them to blow into a syringe or like you're blowing up a balloon, and that can stop the fast heart rhythm. But that doesn't sound like that was what her article was about.
Do you see a lot of these things on social media that are kind of bad information about people's hearts and their health?
There's funny stuff on social media. I guess the good thing is it keeps the heart in people's minds. So, you just reminding people that young, healthy people can have heart attacks. I think that's really positive. You get a lot of misinformation on there as well. But I think it's difficult to read through it. But I think the basic take-home message is if you don't feel right, you've got chest pain, get checked out. And any post that indirectly brings awareness to that, I think is good.
And in terms of maybe ways that younger women can take care of their heart to prevent heart attacks, what would you suggest?
So healthy lifestyle is good, not smoking, exercise, trying to eat healthily. And then I think the other thing is, there's only so much you can do about genetics. So even if you're super healthy, you're a gym bunny, you're working out 5 times a week, you can still have really high cholesterol. And that's only, that's just a genetic factor. So getting your bloods checked every once in a while and getting a physical is always worthwhile.
I also read in the article that anemia can be a reason for heart attacks in younger women.
So it's important to say this is just really severe anemia. So the mild anemia where you're still walking around is usually fine. What we found was people with really severe disease. So your normal hemoglobin's about 14. If your hemoglobin goes down to 5 and you're bleeding and you're really sick, then your heart doesn't deliver enough oxygen to the rest of your body. So we can call that a secondary heart attack or a mismatch in supply and demand. You're not getting enough oxygen, and that's where you get a heart attack.
Or other infections. Is that also the same thing? I mean, how do you measure the infection? Is it also the hemoglobin, or is there another measure?
We've got other markers of infection, but it's usually just how sick the body is. So if your body's fighting the infection so hard that your heart rate goes from 60, which is normal, to 150, or your blood pressure drops and you're really low in your blood pressure and your hemoglobin, then that's the ones where your body's just struggling to fight this severe infection. So this is almost always patients when they're really sick and in hospital or about to go to hospital. It's not the person who's walking around with an infection and still managing at home.
What about very slow heart rates, like in the 30s, and people that have is there any issue or risk that you've seen there?
So sometimes it can cause a problem. So if you're really fit and healthy, then you tend to run a lower heart rate, and athletes often have heart rates in the 40s. If your heart rate's going down to about 10 beats a minute, that's definitely abnormal, and your heart might be struggling to pump enough oxygen to the rest of your body, and that can cause this secondary heart attack.
What are you working on next?
So the next thing is finding treatment. So, we've been good at explaining and showing how common these rare causes of heart attacks are. And the next thing is how can we better treat them? Because most of what we're using is the same medications that we've been using for heart attacks for decades. So is there better treatments that we can use? And we do get people that even if we've tried all the regular treatments, they're still getting chest pain and they're still having problems. So being able to better manage things like coronary spasm or microvascular disease, that's disease in the small arteries of the heart, that's where I really want to find improvements.
What are the treatments now? Are they medications or are there other treatments?
So mostly medications, and we've got some medications that, at least half of people do really well with medications. And then there's around 20 to 30% of people that still have bad symptoms, even with medications. We're doing a trial at the moment of something called the coronary sinus reducer. So it's this odd, very novel stent that you put in the vein of the heart. And that helps improve the blood supply to the heart. So at the moment, we're doing a trial to see if that helps in particular types of microvascular disease.
How do you see issues like sadness or stress affect people's heart?
They can affect people really badly. So there's Takotsubo syndrome, is also known as broken heart syndrome. And when people get a huge emotional insult, so a bereavement or just something terrible happens, your body's just full of hormones and endorphins that actually make your heart stop beating properly. So the pumping function goes right down and can be severe enough that people even need, a ventilator to support them while their heart's recovering. Fortunately, these ones generally, once you get past that immediate insult, we can support with medications and wait till the body heals itself. But they can do, you can have pretty severe disease in between times.
How did you decide to study the heart?
Um, I just had really good mentors. So I went to medical school in UK. And when I was 19 or 20, we had the lecture by one of the professors. He's Professor Paul Wilson. And he was about in his 70s or 80s at the time. And he's unfortunately since passed on. But he gave this amazing lecture where he sang out the heart valves and all the abnormalities. And it was just really great seeing someone that had been doing this his whole life and was still so passionate and so vibrant talking about their specialty. That really got me engaged. So I did a special study module in cardiology, and then I met Professor Darrell Francis, who was my research mentor when I was young, and he was also just amazing. He loved his subject. He'd meet on Christmas Day at 7 a.m. on a Sunday. It was, he always loved doing cardiology, doing research, and seeing people just that passionate about their jobs just was really inspiring. So that's how I ended up in cardiology.
Yes, there is something really special about the heart as an organ.
Yeah.
Are you constantly learning new things about the heart? And is it kind of, are there, um, kind of like the brain, a lot of things that are still unknown, or how would you describe?
There's still loads going on. So you think you know everything and then things change. So even just within, the 15 years I've worked in cardiology, things have changed a lot. So the way we treat the aortic valve, so it's one of the main valves in the heart, we used to always have to do open heart surgery. But in the last 15 years, we've learned how to do it keyhole. So it was first done in a patient in France in 2007, and it's now pretty much our standard of care. There's, 500 patients a year having this procedure done at Mayo Clinic, and we get them home within 24 hours. And it's just incredible. This was something that, people used to be too sick for, or they would die of heart disease. And now we've got this really great treatment.
I see that how the science is really progressing. I mean, my father was in a really bad situation and he's doing great because of the medication.
And that's really nice. We've got a lot of really good treatments for heart disease. So it's a really great area to work in.
Thank you so much, Dr. Raphael.
That's a real pleasure. Thank you so much. It's been great talking to you.
Curious by Nature is a production of Newswise. More than 7,000 journalists get the Newswise wires. Visit newswise.com and find out how to spread your news today.